Oops, there we go. All right, so good afternoon. Thank you for joining us today. My name is Roma. I'm with the Area Agency on Aging, and we are going to be talking about Medicare and Tricare for Life, just a basic overview of what they are and how they coordinate with each other. A couple of housekeeping items real quick. If you have any questions, you are always welcome to type them into the chat box. Otherwise, I will be pausing at intervals during this 15 or 20-minute presentation to see if anybody has any questions. If you have a question you would like to ask when I pause, please feel free to just simply unmute yourself and I will be happy to take your question. Or again, you can type your question at any time into the chat box. Hopefully everybody can hear me all right and everybody is seeing the Medicare and Tricare for Life screen on their device. So let's go ahead and get started. If you are having any problems hearing me, please let me know. Again, type into the chat box or unmute yourself and let me know. Otherwise, let's get started. So again, my name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to help older residents remain in their homes by removing barriers to independence in our 3-county region of El Paso, Park, and Teller counties here in Colorado. We do that by working with partner communities to develop systems for services to help with that goal. I am the SHIP coordinator here for our area, for our region. The SHIP program is the State Health Insurance Assistance Program, which is a federally funded program that is available nationwide, and it's specifically designed to assist and educate people in all things Medicare or potentially related to Medicare. So we provide any Medicare information, education, or assistance or advocacy that someone might need. This is a truly consumer advocate type program. We don't sell or endorse any specific insurance products or companies. The SHIP program through the Area Agency on Aging actually serves 9 counties of Colorado. I've listed them on the slide, as well as our local Colorado Springs number for those 9 counties and the toll-free statewide number that will route someone who calls that toll-free statewide number to the SHIP office closest to them. There should be a SHIP office or a SHIP counselor available at the very least by toll-free statewide number in every county of every state in the country. Our services are free to the public. We never charge for our services, and we are available to help anybody who needs Medicare information. Again, today we're going to be talking about Tricare for Life and Medicare and eligibility requirements, how to enroll, and how they work together. Tricare for Life is an extension of Tricare Health, which is, of course, the health benefit for active duty and retired service members, their spouses, and dependents. Tricare for Life and Tricare were enacted into federal law in 2001, and it was a program designed to restore the promise of lifetime benefits for people who actively served in the military. It was the largest expansion of healthcare benefits for that population in over 3 decades. Tricare for Life specifically is a Tricare program available to retired military or any eligible Tricare beneficiary, regardless of age or where you live in this country, once you are enrolled in Medicare Part A and Medicare Part B. You are eligible for Tricare for Life automatically if you are a Tricare beneficiary as soon as your Part B or Medicare Part A and Part B go into effect. So Tricare and Tricare for Life are not very old programs, only been around for about 20 years. So Medicare, who can have Medicare? Basically, most people in this country will become automatically eligible for Medicare when they age into it, basically by turning age 65, as long as you have contributed into the Social Security tax system through payroll taxes. If you did not specifically contribute into the tax system through payroll taxes, you may still be eligible to get Medicare at 65 based on a spouse's contributions into that tax system. You may also become eligible for Medicare based on being determined disabled by Social Security. If you have been diagnosed with end-stage renal disease or kidney failure, if you have been diagnosed with Lou Gehrig's disease or ALS, or any lawfully admitted resident alien who's resided in this country for at least 5 consecutive years is eligible to purchase Medicare. If you are already collecting an income from Social Security when you become eligible for Medicare under any of those scenarios, Social Security will automatically enroll you in both Medicare A and B. And the premium for Medicare Part B will automatically start being deducted from that Social Security income. If you are not collecting any sort of Social Security income when you become eligible under those scenarios for Medicare, it would become your responsibility to contact Social Security to let them know that you want to enroll in Medicare and arrange how to pay that Part B premium, either by having it deducted monthly from a bank account or by sending them a check every 3 months, whatever. So if you're already collecting any sort of income from Social Security when you become eligible for Medicare, it will automatically be deducted from your Social Security income and you will automatically be enrolled. If you're not collecting income, it becomes your responsibility to make that contact with Social Security to actively enroll in Medicare. So let's do a quick review of Medicare benefits: Medicare Part A, Medicare Part B, and Medicare Part D, the drug benefit. Medicare Part A basically is the benefit of Medicare that most people will get at no cost, based on the fact that you paid into the tax system through payroll taxes. You paid Medicare taxes. So in order to be eligible for Medicare Part A at no cost, you would have had to had a work history of payment into the tax system through payroll taxes of at least 10 calendar years over the course of your entire lifetime. If you don't have 10 years of work history and paying taxes through payroll taxes, you could potentially still be eligible for Medicare at no cost through a spouse's work history, as long as you and that spouse were married for at least 10 years. Medicare Part A covers all your inpatient services. So it covers inpatient hospitalizations, it covers skilled nursing facility or rehab care after hospitalization. It provides the hospice benefit of Medicare as well as home health care benefits. The coverage is through Medicare in general is not typically 100%. Coverage under Part A, again, inpatient hospitalizations, Medicare pays 100% for an inpatient hospital stay after an initial per admission deductible, which this year is $1,482. Again, every time you're admitted to the hospital, Medicare will pay for that hospital stay after you pay an initial $1,482 deductible, and that's each time you're admitted. For the skilled nursing facility or rehab care after a hospital stay, Medicare does typically pay 100% for that stay after they apply a 20-day at $182 per day coinsurance. So if you are discharged from the hospital and you are going to be in rehab for 4 to 6 weeks, the first 20 days of that rehab stay, Medicare pays everything after they apply a $182 coinsurance, meaning they'll pay everything except for $182 per day for the first 20 days. And then you would be covered at 100% for the next 80 days. So Medicare will pay all or part of up to 100 consecutive days at a time in rehab. Hopefully you wouldn't need to be there that long, but the first 20 days, Medicare pays everything except $182 a day. And then starting at day 21, Medicare pays 100% for that continued rehab stay after hospitalization. So those would be your out-of-pocket costs for Part A services. For Medicare Part B, everybody who is eligible for Medicare Part B and enrolls in Medicare Part B has to pay a premium for Medicare Part B. There is no getting out of having to pay that premium. For most people, Medicare Part B premium for 2021 would be $148.50 per month. Again, that premium would typically automatically be deducted from Social Security if you're collecting a Social Security income, or it could be, if you're not collecting income, you could arrange to have that premium deducted from a bank account every month, or you could write them a check every 3 months. However, the Part B premium is means tested these days. And what that means is if you have a higher annual income, and the threshold for a single person is about $86,000 a year, double that for a married couple. If your income is in that higher income bracket, you may actually pay a higher Part B premium based on that income. But for most of us, again, the Part B premium this year would be $148.50. Part B services are going to be all of your outpatient services. So your doctor's visits of any and all kinds, specialist, primary care, regardless. Outpatient surgeries, outpatient therapy, outpatient, any outpatient medical needs would be covered under Part B. Part B also does have a home health care benefit. Part B is what provides all the durable medical equipment, such as oxygen, wheelchairs, walkers, that kind of stuff. And most, all preventive services covered by Medicare are covered under Part B. So coverage under Part B, there is an annual deductible for Medicare Part B services. This year, that annual deductible is $203. So whatever services you have first each year that are billed to Medicare Part B, Medicare is going to apply to that $203 deductible this year. Once that deductible has been met, meaning they're not going to pay the first $203, once that deductible is met, then Medicare pays for most Part B services at an 80-20 split. And then there's Medicare Part D, which is the newest benefit of Medicare. D stands for drugs. It's the Medicare prescription, outpatient prescription benefit. Although if anybody is eligible for Tricare, the Part D benefit is not a requirement, it is not a necessity. The drug coverage available through Tricare in any form is going to be considered better than what Medicare offers under Part D, which means you would not be required to enroll in Part B once you become Medicare eligible. If you decide to use Medicare and Tricare or Tricare for life, Part D is not going to be something you need because Tricare includes drug coverage. So I'm not even really going to talk about Part D. Any questions about any of that so far? Again, if you have a question, you can unmute and simply ask, or you can type into the chat box. No questions? Okay. And I almost forgot, hopefully anybody attending checked their email before this presentation started. I did send out an email that included the handouts for this presentation, as well as a copy of these slides. If you did not get that, please let me know at the end of the presentation. I'll make sure I resend them. Okay, so enrolling in Medicare, there are certain enrollment periods you need to be aware of when you become Medicare eligible that you need to use to enroll in Medicare. Basically, when you become eligible for Medicare, primarily based on turning age 65, you will be in what's called an initial enrollment period with Social Security and Medicare. That initial enrollment period is going to be a 7-month window that surrounds the month of your 65th birthday. Most people do become eligible for Medicare based on aging in or turning 65. So that initial enrollment period is going to be the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. That is your window of opportunity to enroll in Medicare without penalty. If you do not enroll in Medicare during that 7-month window, and you don't have other coverage in place of Medicare, such as employer coverage, employer health coverage, then you would have to wait to enroll in Medicare during a different enrollment period, and you could potentially have to pay a slightly higher premium for Medicare because you may be penalized for not enrolling when you first became eligible. The exception to that rule would be if you fall under a special enrollment period. Basically, a special enrollment period is going to be applied to someone who delays enrolling in Medicare because you are still actively employed. And through that active employment, you have health benefits. And that can include you and or your spouse. So if you are still actively working when you become eligible for Medicare, you are able to delay enrollment in Medicare in favor of that employer group health coverage. When that employment ends and that employer group health coverage ends, you would have up to 8 months to enroll in Medicare from the time that coverage ends. Or you can enroll at any time while you're employed. So you can enroll right before you decide to retire and lose your coverage into Medicare so that you have no lapse in benefits. You transition from employer coverage directly to Medicare. But you would have up to 8 months after that employer coverage ends to actually enroll in Medicare without being penalized. If you don't enroll in Medicare and you don't do it during your initial enrollment period, you don't fall under a special enrollment period, you just simply didn't think you needed Medicare and decided not to enroll, but down the road you do decide you want Medicare, you would have to wait for the general election period, which happens every year. The general election period is from January 1st to March 31st each year. However, if you're enrolling during the general election period, your benefit wouldn't actually start until July 1st of that year. And because you did not enroll during your initial enrollment period and you did not fall under a special enrollment period, you would potentially be penalized for not enrolling sooner. It's called a late enrollment penalty. So you would potentially pay a higher Part B premium because they're going to charge you an extra 10% for every year you delayed enrollment into Medicare and didn't have other coverage. Any questions about any of that? Okay. To enroll in Medicare, basically you have to contact Social Security. Social Security is who is responsible for determining who's eligible for Medicare based on work history and payroll taxes. Social Security is who actually processes enrollments into Medicare, issues the Medicare card and replacement cards. Social Security is available by toll-free customer service number, the national number. You can actually go to the Social Security office, although I don't think they are currently taking walk-ins yet due to COVID, or you can go to the socialsecurity.gov website and set up a My Social Security account and enroll in Medicare online. But you do have to do that through Social Security. They are responsible for those enrollments. Again, if you're collecting an income from Social Security when you become eligible for Medicare, Social Security will automatically enroll you in Medicare when you become eligible, and they will automatically start deducting the premiums for Medicare out of your Social Security check unless you tell them not to. Once you have Medicare, then Social Security wants nothing to do with Medicare. And at that point, any questions or concerns you have regarding your Medicare benefits would be directed to Medicare itself. Medicare, or the Centers for Medicare and Medicaid Services, administer the Medicare benefits. They process the claims. They determine what's going to be paid for. They pay the providers of service directly. Medicare is available by toll-free number, 24 hours a day, 7 days a week, 1-800-MEDICARE, or you can go to the Medicare.gov website. Medicare does not have any local brick and mortar offices. They're only available by toll-free number if you want to talk to a live person, or you can get information on their website. So Security, you can go to the location here regionally, but with Medicare, you can only contact them by phone or go to the website. Or if you have Medicare questions, you can contact your local SHIP office. That's us. And we're always happy to help with any Medicare questions, concerns, or information. So, who would be eligible for Tricare for Life once you become eligible for Medicare? So eligibility for Tricare for Life and the requirements to enroll in Medicare based on that eligibility may differ depending on the reason you're becoming Medicare eligible. So if you're becoming Medicare eligible because you're turning 65, if you're becoming eligible for Medicare based on being disabled, if you become eligible for Medicare but are still actively employed and want to delay enrollment, or if you are still on active duty when you become eligible for Medicare. All of those things factor into when you would want to or need to enroll in Medicare and still be able to keep Tricare. In order to have Tricare for life, you must be enrolled in both Medicare A and B. So there are some situations where, such as if you're actively employed with employer group coverage, you would delay enrollment into Medicare, which would delay enrollment into Tricare for life in favor of that employer coverage. In a situation like that, you can make that delayed enrollment into Medicare without penalty, but Tricare would not be active while you're still actively employed with group coverage in that scenario. But once you enroll in both A and B, once that employment ends, Tricare would automatically go into effect as a secondary to Medicare. Tricare for life is provided at no cost to anybody who is eligible for it, but it is strongly encouraged that you contact your local DEERS office to let them know when you do enroll in Medicare. If your enrollment into Medicare is automatic based on the fact that you're collecting Social Security, then Tricare for life is automatic because that information is shared with Social Security and Tricare. But if you plan on delaying that enrollment into Medicare or something like that, you would want to contact the DEERS office when Medicare does go into effect, since it won't be an automatic enrollment. Today, we're primarily going to discuss eligibility into Tricare based on turning 65, just because that is the most common scenario. So if you are becoming age 65 and that's what's creating your eligibility for Medicare, there are some things you need to know about your eligibility for Tricare. So if you're becoming eligible for Medicare because you turned 65 and you are entitled to Medicare Part A at no cost because you paid taxes, if you want to retain coverage under Tricare, you must enroll in Medicare Part B. If you are a retired service member, which includes the National Guard and Reserves, if you're a family member becoming eligible for Medicare of a retired service member, Medal of Honor recipient, survivor of a deceased sponsor, or an eligible former spouse. Again, if you are eligible and entitled to Medicare Part A at no cost, you fall under one of these eligibility categories, Tricare is going to require that you enroll in Medicare Part B in order to keep Tricare coverage. However, if you're eligible for Medicare at no cost because you paid taxes, but you're still active duty, or you are actively employed and covered under the employer group health plan, or your spouse is actively employed and covers you under that employer group health plan, you would not be required to enroll in Medicare Part B immediately in favor of that service or that employment coverage. If you're active duty, when that active duty ends, you would get that 8-month special enrollment period as long as you delay enrollment into Medicare to enroll in Medicare. And as soon as Medicare enrollment goes into effect, Tricare for life would kick in. If, again, you are actively employed or you're covered under a spouse's active employment group health plan, when that employer group health plan coverage ends, you're encouraged to enroll in Part B right away so that there's no break in your medical coverage. But again, Tricare for life would go into effect immediately as soon as both A and B of Medicare are in effect. Both of those scenarios are assuming that you enroll in Part A when you become eligible for Medicare, and then delay Part B because it has a premium in favor of the employer coverage or active duty service coverage. However, if you choose not to enroll in any part of Medicare when you become eligible in favor of active duty coverage or employer coverage, you can do that as well. And until you actually enroll in both parts of Medicare, you would continue with whatever coverage you currently had in the meantime. So if you're active duty, obviously you have regular Tricare. If you are retired from active duty and eligible for Tricare, but have opted to use the active employer group health benefits instead, you would be able to continue with those benefits until you choose to enroll in Medicare based on those situations. Any questions about any of that? You guys are awful quiet today. Let's see. Okay, so I do have a question in the chat. Does my spouse have to be enrolled into Tricare for Life even if she is younger? So if your spouse is becoming eligible for Medicare, regardless of age, and she is not currently covered under an active employer group health plan or your active employer group health plan, if she is eligible for Tricare and doesn't have that other coverage option, then yes, she would be required to enroll in both A and B of Medicare in order to keep Tricare benefits of any kind. If she chose not to enroll in Medicare for whatever reason, as long as it's other than being covered under active employer group health benefits, she could potentially lose Tricare coverage completely. So if she doesn't have that other coverage option, such as an employer group health plan, yes, she would have to enroll in both A and B of Medicare in order to be eligible for Tricare or to continue with Tricare through Tricare for Life. Hopefully that answers your question. And the same would apply to the retiree. Unless you have other coverage through an employer, when you become eligible, you would want to enroll in Medicare so that Tricare for Life kicks in. If that didn't answer your question completely, just let me know. So the way Medicare and Tricare work together, basically, when you become eligible and enrolled in Medicare, Medicare will always be your primary health benefit. So it will always be the payer of first resort. Tricare for Life, when enrolled in with Medicare, is basically going to act as a wraparound or a Medicare supplement. So Tricare for Life will basically be there to pick up any balances, deductibles, out-of-pocket costs that Medicare Part A and Part B left over after they paid their part first. So theoretically, between Medicare A and B and Tricare for Life, you could pretty much have 100% medical coverage with little to no out-of-pocket for any services you may need. Quite frankly, that provides that those benefits together are honestly probably some of the best coverage available in this country today for anybody. Medicare and Tricare for Life really has always been one of the best coverages available in this country. Tricare for Life does not cost anything. There's no premium for Tricare for Life. As long as you pay the premium for Medicare Part B, your out-of-pocket cost will basically be that monthly Part B premium for any medical care you need anywhere in this country. However, there may be some services that are covered by Medicare but may not be covered by Tricare. In that situation, for example, Medicare may cover chiropractor services. Tricare for Life does not cover chiropractor. So in a situation where you are going to a chiropractor, you have Medicare and Tricare, Medicare will pay their part, their 80% for that outpatient Part B service, but Tricare for Life will not pick up the balance. So you would have to pay that 20% that Medicare left over for those services. On the other hand, there may be services that Tricare will pay for that Medicare does not. Unfortunately, that's not going to be a very big category of services. Neither of those scenarios are going to be a big category of services that one covers that the other does not. But one of the biggest benefits of having Tricare is that Tricare will pay for medical care that you may need outside of the United States. Whereas Medicare benefits stop at the border of the United States of America and or our territories. So once you leave our borders, Medicare coverage cuts off right then and there. And Tricare for Life would be able to provide medical care coverage outside of the US. Some services may be covered by Tricare only, would not even be a benefit of Medicare. Fortunately, I could not find any good examples of that. But in that scenario, if you needed a service that was only covered by Tricare and wasn't even a benefit of Medicare, Tricare would pay primary and you would have to pay whatever balance Tricare left over. Or vice versa, if there's a service covered by Medicare, but not even a benefit of Tricare in any way, shape, or form, Medicare would pay their part and you would be responsible for whatever balance Medicare left over. But again, because it was hard to even find these few examples of those situations, for the most part, you should have basically 100% medical coverage between Medicare and Tricare for Life. Tricare for Life will pay the hospital deductible every time you're admitted to the hospital after Medicare. It will pay the Part B annual deductible every time. It will pay the 20% for Part B services that Medicare leaves over after the deductible is met each year. So for Part B services after deductible, Medicare pays 80-20. Tricare for Life pays the 20%. Hospitalization, every time you're admitted, Medicare pays everything after that $1,482 deductible. Tricare for Life pays that $1,482 deductible every time. So basically you should have 100% coverage between those two benefits. So again, the bottom line is Medicare and Tricare for Life are basically going to be some of the best coverages you can have in this country today. Benefits that are well earned and deserved, benefits that have been acted into law, so they cannot be taken away except by an act of Congress, which wouldn't be, very likely to happen, and are benefits that you should be using or accessing. Now, again, if you're actively employed, and I know many retired service members may retire and move on to the private sector, but work still for perhaps the federal government. I know in this area, we do have a lot of federal retirees who are also military retirees. If you are a federal retiree as well as a military retiree and entitled to both Tricare and federal retirement and health benefits, that's not a bad thing. And you would be able to choose or decide which benefit you would like to use as your benefit after Medicare. Or you can have all benefits. You can have Medicare as your primary, then the federal retiree coverage would be your secondary and would basically pick up whatever Medicare left over, just like Tricare. And then if there's anything left over after that, that could be billed to Tricare. You can have all three benefits, or you could potentially suspend your federal health benefits in favor of Tricare, since you would have a premium for the federal benefits, but no premium for Tricare, and they would both pay after Medicare. So you have a lot of options in that situation, and I do come across a lot of beneficiaries who have that situation. It just gives you more flexibility. Let's see, any questions about any of that? I do have a question in the chat box. It looks like, please speak to vision, dental, and hearing coverage with Tricare if it is available. Okay, so this is a good question. So Tricare for Life is a benefit that's designed to supplement Medicare and pay the balances that Medicare left over after Medicare pays first for Part A and Part B services. However, Medicare does not currently cover routine vision services, dental care in any way, shape, or form, and it does not cover routine hearing services. And when I say routine vision or routine hearing, what I mean is if you go to the optometrist once a year to see if the prescription, your eyes have changed and you need to change the prescription on your eyeglasses, that is not a benefit of Medicare. It's considered a routine or non-medically necessary service. So it's not a benefit of Medicare at this time. Because it's not a benefit of Medicare, it's probably not a benefit of Tricare. Same with dental, same with hearing services. If you need to go to an audiologist to check your hearing or get hearing aids, those are not benefits of Medicare at this time, and so would not typically be benefits of Tricare. Tricare will change from complete coverage to simply completing Medicare coverage. And so if it's not a benefit of Medicare, typically it's not a benefit of Tricare. Having said that, those services may be available through VA benefits. They may be available if you have employer coverage or something like that. But as far as Tricare for Life specifically, not typically going to be benefits of Medicare with Tricare for Life. Tricare for Life would not cover those services above and beyond Medicare coverage. So hopefully that answers that question. But you can get that benefit. You can purchase those benefits anywhere else. You can go to the marketplace, the Affordable Care Act marketplace, and purchase dental coverage and dental and vision coverage. If you, again, have that available through an employer plan or a retirement plan through a private sector employer. Any other way you might be able to get those benefits, you're welcome to get them. Medicare doesn't care simply because they don't currently cover them. Now, there has been talk at the federal level that those benefits may soon become part of Medicare, but until that actually happens, which could be next year, it could be 20 years from now, at this point, you'd look at other options. Any other questions? All right, well, you guys are awful accommodating. Resources, if you have additional questions after this presentation, or you think of questions that you wanted to ask but forgot during the presentation, you're always welcome to contact your local SHIP office. Again, that's us. And we are happy to answer any questions, possibly potentially related to Medicare in any way, shape, or form, which includes any sort of retirement benefit. I've listed our local Colorado Springs numbers. And again, the previous slides showed the Colorado statewide toll-free number that would route you to the SHIP office closest to wherever you're calling from. You can go to the Tricare website for Tricare for Life. You can download the Tricare for Life handbook, or if you request it by email, I'm happy to forward that electronic version of the Tricare for Life handbook to you. If you have questions about your eligibility for Tricare, you can call the Defense Manpower Data Center Support Office. I provided the toll-free number. Questions about Medicare, again, you can call Medicare at their toll-free 800 number, 24 hours a day, 7 days a week, 365 days a year. They're always available by phone, or you can go to the Medicare.gov website. Questions regarding enrolling into Medicare or eligibility for Medicare or any other Social Security related issues, you can again go to the Social Security website, ssa.gov, or call the toll-free national number for Social Security. Social Security is available by phone Monday through, or 7 days a week, 7 a.m. to 7 p.m. basically in all time zones. And again, if you are interested in having an electronic version of the Tricare for Life handbook, I'm happy to email that to you if you simply shoot me an email and request it, or any other resources. For Medicare and for Social Security, you are able, both websites allow you to create basically a personalized account. So at Social Security, it's called a My Social Security account. That account setup would certainly be helpful if you wanted to enroll in Medicare through the Social Security website, which is certainly doable these days. And Social Security actually recommends that you do it that way. You'd simply go to the ssa.gov website and click on My Social Security and create an account. You can do the same with the Medicare website, medicare.gov. Go to medicare.gov and click on My Medicare account and create a Medicare account, personalized account. Both accounts do have the benefits of being able to personalize your information, being able to look at claims, being able to look at enrollment status into Medicare, income status for Social Security purposes, histories. So there are a lot of benefits to having those accounts, but those accounts are not required to have in order to get the information or do what you need to do with either of those entities. But I did include in the email I sent earlier, I included a sheet on how to use the Social Security website to create a Social Security account and enroll in Medicare. And again, this is a handout that tells you how to create a My Medicare account. It looks like I do have another question. Does Medicare ever cover for assisted living or skilled nursing facilities or VA? So for Medicare to cover any sort of facility stay, Medicare only covers what they consider medically necessary. For facility care, Medicare only considers a skilled nursing facility inpatient stay for rehab purposes, rehabilitation purposes after a hospitalization. So if you have a 3-day or longer inpatient hospital stay, and then you're discharged to a skilled facility for rehab after that stay, Medicare Part A will again cover up to 100 days. The first 20 days, they'll apply or pay everything except that $182 per day. And then up to the next 80 days would be paid at 100%. Assisted living care or skilled nursing facility stays that are not going to be for the purpose of rehabbing to go back to the home or go back to living in the community are going to be considered custodial care or not medically necessary care, long-term care services or long-term care stays. Medicare does not cover those things, so would not pay for someone to be in assisted living or in a skilled facility if it's just for long-term stay care, based on the fact that you can no longer maintain independence in your own living environment. Does the VA cover those services? That depends. If you're eligible for VA benefits, it would depend on the level of eligibility. It would depend on income eligibility. VA typically does not cover assisted living care, but they will cover what's called aid and attendance, which would be a benefit that might provide in-home care to help someone stay at home. So it would be maybe the same level of assistance that someone would get in an assisted living, but you would get that at home and someone would come to the home to help you with those needs. VA will also cover long-term care facility stays, so 24-hour care in a facility, typically as long as you go to either a VA facility or a VA approved facility. And again, that might be dependent on income eligibility. So sometimes those benefits may be income based on need. That would certainly be something that I would encourage you to explore directly through the VA. If you need more information on how to get or find more information on eligibility for those benefits, our agency does publish a booklet every year that explains both Colorado adult Medicaid benefits and VA benefits and how to access them and where to get more information. And I'd be happy to provide that information to you. Currently, that booklet is available by electronic download or directly by a website link to our website. So again, if someone is interested in more information about how to get those benefits or the eligibility for those benefits, shoot me an email and I'd be happy to provide that information. Again, the SHIP program is a program that's available nationwide. Every county and every state should have access to a SHIP counselor that has no cost for them. We do not endorse any specific insurance products or companies. We are true consumer advocates designed to help you understand and educate you on your Medicare options so that you are the most educated consumer you can be. This provides our statewide toll-free number. Again, we'll route you to the SHIP office closest to wherever you're calling from in the state. Our office also does the S&P program, which is the fraud and abuse education and information program for anybody who is suspecting that something not quite right is going on with either agents or insurance companies. If there's a claims problem, someone's not paying what they should be paying for services you received. Any of those kinds of things, you're welcome to call our office as well, and we can help you navigate through that issue. Or you can call, again, the statewide toll-free number, the S&P hotline, or contact our office. We're happy to help with those kinds of issues. I do want to mention that this Lunch and Learn presentation is one of many presentations our agency offers. Many of our presentations are Medicare related. However, we also offer currently twice a year a whole retirement series of presentations, which are basically 5 presentations over a 5-week period on the different aspects of retirement. So if you are getting ready to consider retirement or have recently retired, we will be having another round of this retirement series in September, or maybe it starts the end of August, early September. It provides presentations on the social aspects of retirement, estate planning. There's a Medicare presentation. We have Social Security do a presentation. We get a representative from public relations at Social Security. So it's a lot of good information and a lot of different aspects of what you need to know about retirement. If you are interested in getting more information or registering for that service or that series, again, it starts at the end of August and runs through September. You can visit our website at ppacg.org/events. I will also type that into the chat box for you. And pretty much, I think that is all I have. Here's our contact information locally again. So if there's any last minute questions, you're welcome again to unmute or simply type into the chat box. I'm going to put our website into the chat box for everybody. And again, you can email me if you want any additional information or for me to email you any additional resources I may have mentioned. If there are no other questions, again, I appreciate you attending this presentation today. Hopefully you found it helpful. There will be a survey sent out in response to this presentation. We do strongly ask you to complete the survey. It helps us determine what kinds of information we decide to present on. We're always open to suggestions, so any information you may feel would be useful, we're happy to maybe create a presentation around that. But again, any questions down the road or in the future, more than happy to let you give us a call, shoot me an email, and we're happy to help in any way we can. And again, if you want me to email you the Tricare for Life handbook or the Colorado Adult Medicaid and Veterans Benefits Handbook, just let me know by email. If you type your email address into the chat box or just send me an email at theseniorinsure@ppacg.org, I'm happy to do that. Otherwise, if there are no other questions, I will let you all go and hope to see you all again at our next set of presentations. I will be doing a 4-week, 4-part series, Medicare 101, starting next month. That goes into much, much more detail about Medicare and all of the options available to go with Medicare, including Part D. And then the month after that, obviously we will have that retirement series as well. So again, please feel free to go to our website at ppacg.org/events to get more information about those upcoming presentations and to register. Otherwise, thank you again for joining us and have a great afternoon.